we've also seen laws being different in different countries for that matter, right? So how does that affect, right? Having different laws in different countries for cybersecurity. We have HIPAA in the US, we have different regulations in the United States and in the Asian Pacific region. So how does that help and for different countries, right? For cybersecurity, does it make things harder, and how do you handle things for post-attack in these situations?
There's no question that the differentiation in regulation adds a layer of complexity. Complexity adds a layer of cost. And as complexity increases, difficulties of compliance increase as well. So in the area of something where there's no disagreement, right? I don't think there's a country in the world that doesn't think that healthcare data should be protected at the highest possible level. So it's a good example of perhaps where to start with international agreements on standardization of healthcare, of information protection. Right? Again, it's sectoral, right? And so some countries may say, oh, we don't want to do anything that's sectoral. But nonetheless, again, as we've already identified, even with countries that have a non-sectoral approach, they more often than not highlight additional protections for healthcare information. Healthcare information also has the lowest governmental interest. So when it comes to something like financial information, governments have an interest in fighting crime, money laundering, and terrorism, such that there's some disagreements as to how much the government can peek into that data. There's no such interest in most healthcare information. Healthcare information does not lead to uncovering terrorism cells. And so as a result, it should be the exemplar for attempts to create true international standards on data protection. And then over time, we could build out to simplify some of our models so that there were, in fact, global safe harbors. And that if you meet this compliance standard, it applies across every country that you're doing business in. And therefore, you don't have to have different systems in different countries. Healthcare is the perfect place to start that kind of model.
Yep, and I completely agree with you on that. And can you also touch a little bit about how these laws, right, affect cybersecurities in different ways? Because every country has their own law and their own procedure of dealing with things. But how do these laws in general specifically affect cybersecurity when it comes to the healthcare industry?
Well, take HIPAA for an example. In the US, the HIPAA model has a very aggressive, very, I would argue, clear set of mandates for both the expectations of privacy for the information, the levels of encryption that are required for that information, um, um, and as well as very prescriptive cybersecurity obligations that go beyond the technical measures to include the physical measures and the administrative measures, right? So you have a regime that is very, very strong. It has a regulator that's empowered to impose very severe fines. As a result of that, there is a huge incentive to not be within that regime. And so the positive is that healthcare that is covered gets a great deal of protection. But the negative consequence is that, of the 350,000 apps that have healthcare data on them between the Android App Store and the Apple Store, very, very few of those are actually part of the HIPAA regime. The vast majority of them are for entertainment purposes or otherwise outside the regulatory regime. And so there is almost no protection for that information. That disconnect creates disincentives to protect the information and strong incentives to avoid regulation. Right? The same thing is true in every country that has the ability to regulate certain activities different from other activities. It also creates a system where you have a government regulator rather than any kind of consumer response, right? And so one of the upsides of the US system in some jurisdictions is what we call the private right of action. It means that if a consumer is harmed as a result, we don't have to wait for the government to bring cause of action. GDPR is much more comprehensive than many of the laws in the United States. We're catching up in a number of areas, but nonetheless, the enforcement regime is actually much smaller in Europe than it is in the United States because of the way our overlapping laws allow there to be enforcement. So creating more enforcement rights for individuals, healthcare organizations, would also be a way of increasing the pressure to take the healthcare sector seriously and expand its reach.
We've talked about data breaches, data thefts. We've talked about multiple instances of how healthcare industry can build itself up or improve from how data is being taken care of. But for smaller basic things, let's get to the basics right here. What are some basic things that a healthcare industry should follow, if you were to suggest a few things to protect itself from a cybersecurity attack and potentially get themselves out and not in a situation where they are stuck in a data breach or a cyber attack for that matter?
Sure. So what we've seen, again, if a company is regulated by something like HIPAA, it must be in a very high regulatory regime, right? It's got the prescriptive cybersecurity obligations, multi-factor authentication, end-to-end encryption. The real issue, there's two issues that raises. One is for a smaller vendor, although the regulations are theoretically flexible enough to take small vendors into account, in practice, they really don't have the ability to invest in the kind of infrastructure that they need. And so that's having, unfortunately, its own unintended consequence of getting rid of a lot of small players in the healthcare sector. Um, for companies that are in the allied relations, not actual healthcare providers, that's where we have the most that we can do. And it's very important for those companies to get as close to the kind of protections that HIPAA mandates as possible, even if they're not regulated by the system. So again, multi-factor authentication, for all of its consumers as well as all of its staff and vendors. We want to have data minimization practices. That's really key. It is required for regulated entities, but it's something that's oftentimes overlooked, particularly in the nonprofit and NGO space. So a small nonprofit or NGO may have a relatively modest sized staff, and they don't think about data minimization, that their customers and support don't need to be accessible by the vast majority of their staff members, and certainly not by their volunteers. And so having different kinds of logins, different kinds of access procedures, so that that data is not available in general. If there is a successful phishing attack, it affects people who do not have access to underlying healthcare information or related data. Those are the kind of steps that are really essential for these allied organizations and companies that help healthcare data that's not regulated data to undertake. And that's where a lot of information first becomes available for theft, and then that allows the data thieves to work their way up the food chain into the more heavily regulated entities.
Yep, definitely agree on that. I think we touched on implementing multi-factor authentication, minimizing data, making sure you have different logins for different users, and restricting access and making sure the roles for access and what users can view is taken care of. I think these are very good points to get started with and technologies healthcare organizations can invest in. But ending before ending the podcast, right, I want to talk about the impact of the data breaches in general, right? And data breaches are not good. They expose a lot of details about users, and they also in some way affect patients' trust, right? So do you have any examples of any recent data security breaches or incidents that have affected healthcare systems in the United States?
There have been, I haven't looked at the headlines this week, but there have been just a regular list of hits targeted at hospitals and healthcare providers. We have seen week after week targeted ransomware attacks on hospitals. And of course, because that directly into a ransomware attack where data is encrypted shuts down a medical facility, stops scheduled procedures, may make an operating room or emergency room unavailable to the public. These ransomware attacks are hitting an extremely vulnerable vendor who really can't afford to go offline as a result of it. And so there's a lot of pressure just because of the ransomware attacks. We've also seen, right, and this is much harder to track, but we're seeing a continued misuse of personal information that results in surgeries being done, prescriptions being filled, and individuals losing access to their own health care as a result of activity on their insurance record that they weren't parts of. So we're seeing these kind of activities. They increase significantly in 2021 and 2022. We're just starting to get the end of year data. Looks to be another record-breaking year for the scale of these attacks. So even though companies have stepped up their efforts to stop the harms, the number of attacks continues to increase as well.
Yep, definitely. I think there is still a long way to go here for all organizations to stay safe and secure, particularly for the healthcare industries, because we are dealing with such confidential data. But I think that brings us to the end of our podcast. So, any final thoughts or any message for our viewers and listeners who are watching and listening to this podcast?
I really appreciate the time to speak with you. I think for me, the most important takeaway is that we need to think of the public health system very broadly and think about not just the cybersecurity risks, but the misinformation and disinformation risks that are part of the cycle. And so when we think about end-to-end security for healthcare, we're not just thinking about information in my personal health record, but every place in the Web 2.0 and burgeoning Web 3.0 marketplace where health information flows back and forth. And we need to think about an end-to-end holistic system to protect the public from disinformation and information misuse. And with that, I really appreciate the chance to share that.
Yep. Thank you. It was a pleasure hosting you here in Secure Insights, John. Thank you for all the insights, and thank you for all the listeners sticking around and listening to our podcast. Stay tuned. We'll also have more coming in. And thank you once again, John. And it was a delight talking to you and getting all the insights that you had to share. And take care. Thank you. Thank you for listening, and goodbye.